What about for people who continue to work and have coverage through their employer, or perhaps have a spouse who's working and are covered under that employer's plan?
Yeah, great question. So, as I mentioned the initial enrollment period earlier, right? You turn 65, you're in this window where you're first eligible for most people. And people wonder, well, what do I have to do? I must have to do something. Even if I'm working, do I have to tell the government that I'm not going on Medicare? And you don't. You don't have to do anything necessarily. Now, most people who have a group plan are going to be able to continue on that group plan without going on to Medicare. And sometimes, like you mentioned, a spouse, you might really need to stay on there. Even if you're ready to retire, your spouse is a few years younger, you're just going to keep working to make sure he or she is covered and of Medicare age. So basically, the way Medicare looks at it is on employer size. So if you're at 20 or more employees, then Medicare says, okay, the employer coverage is primary. And in that case, you can go ahead and keep your coverage. It will pay first. Typically, no need to get Medicare, although a lot of people will get Part A, which is premium-free hospital coverage. It will be secondary to their employer coverage, so it's nice to have a little something extra. But of course, there's always a nuance or an exception to the rule, and that would not be the case. You would not want to get Part A if you are making health savings account contributions, right? So there's always a little something to make sure you're asking about, but a lot of people can delay Medicare. If you are, self-employed, you're on a small group plan with, less than 20 people, you're on an individual, ACA plan, those folks, you have to go on Medicare. Otherwise, you may face late enrollment penalties later and be subject to perhaps you being the primary payer, which obviously that can be a dangerous thing if you're covering 80%, right? So biggest thing is check on employer size. And, certainly could talk to HR, your benefits administrator, just to be sure it's what Medicare considers creditable coverage.